So I'm from Gainesville, Florida originally, and I moved down to Miami for medical school. And then after that, I went up to Brooklyn, SUNY Downstate for residency. And then I worked in Asheville for a couple years. And then I decided that I wanted to start my own practice, which is where I formed Pisgah Eye Surgeons down in Greenville, South Carolina. So my favorite thing about ophthalmology is that I could do a cataract surgery in five or so minutes, and I can really change a patient's life. So I can have somebody come in, and they won't be able to see much at all, and I can do surgery on them. And the next day they can drive, they can see their grandkids. You need to stop being so robotic, and it needs to be kind of funny. I can just edit out stuff I don't want.
Okay. Okay. What is cataract surgery?
So what cataract surgery is, I brought my little model here. Josie lets me use it. So I've got the eye right here, and there's this lens in the front, and this lens is really cloudy. And what a cataract is you're looking through this lens, and it's hard to see through a cloudy lens like this. Imagine you're driving and your windshield is covered in paint, and you can't see through it. So what I need to do is I need to take this lens out and replace it with a clear one. Josie, come here. You're going to come up here? So I take the lens out, replace it with a clear one. That takes me about 5 or 10 minutes. And I typically do one eye, and I'll do the other one, maybe the next day, maybe 1 or 2 weeks later, kind of whatever you want. Healing time, typically a couple of days. The day of surgery, the vision is never very good. But the day after or the day following that, vision should start to get pretty decent. So the lens that insurance covers will give most people decent distance vision. If you have some astigmatism, then you'll need a lens to fix that astigmatism. What astigmatism is that some eyes have a certain shape where instead of being a perfect sphere like a basketball, they're shaped more like a football. And that causes you to not see so clearly. We can either fix astigmatism with contacts and glasses, or my favorite way is through cataract surgery with an astigmatism correcting lens. So if somebody doesn't have astigmatism and they just need cataract surgery, the standard lens will give them pretty good vision for distance. They won't be able to see anything up close. So, for example, the dashboard, cell phone, computer, all that will be kind of blurry, and you'll need some reading glasses for that. If we fix the astigmatism, you'll have pretty good distance vision. And once again, you'll need a little bit of help for things up here, for a menu or cell phone or whatever. One lens option that we have that will help with that is the multifocal lens. And what this lens does is it gives you distance vision, out the window vision, gives you arm's length vision. This could be a computer, this could be a cell phone, this could be a menu, and it gives you vision up close. This could be the newspaper, or maybe if you want to read a book. And I think that lens is a really good option for a lot of people. What I hear people complain about most often is, I have really good distance vision, but I find myself doing this constantly. I want to look out the window, then I have to look at my phone. Just put the reading glasses on. Someone sends me a text message, I have to put the reading glasses on. So what I think is most functional for most people is to not have to put the reading glasses on 20 times a day. And that's what I try and steer most of my patients toward. I think it gives you a better quality of life, not having to be so dependent on the reading glasses. I personally would find that very annoying. And I try and explain this to everybody because I really don't want somebody to 6 months after their surgery realize that they made a wrong decision and they should have gone with a different lens, because I generally do not go back and put, if you wanted the standard lens, I generally don't go back and put in a different lens. So the sedation that they use for cataract surgery is kind of like a little bit of Xanax. You're going to feel a little bit of drunk. You'll be kind of out of it during the surgery, but you won't really have much memory of what's going on. You'll be able to follow commands. So if I tell you to just look at the light, you'll be able to do that. There's also some topical anesthetic that we're going to put on, and I think the topical anesthetic is generally enough. And then the sedation is just to kind of help everybody with their nerves. It's very rare that I hear someone complain about pain during cataract surgery. The most common thing that people complain about after the surgery is when I rip the tape off, because I have to tape your head down so you don't run off the table. I have to chase you down. But that's the most common painful thing, is just taking the tape off after the surgery is over. So once I do the cataract surgery, the cataracts do not come back. You can get something called, some people call it a second cataract. The real name for it is posterior capsular opacification. And what this is it's a scar tissue that grows behind the lens. And this is very, very normal. It happens in about 30% of cataracts. Just like if you brushed your elbow on the concrete, you get a little bit of scar tissue on there, and 6 months later you might have a residual scar. It's kind of the same thing because there's some trauma to the lens capsule where the lens is being put during the surgery, and that can tend to cloud over. The solution for it is really easy. It takes me about 30 seconds, and I use a laser that I've got in the clinic. There's no pain with it. And once that second cataract or the posterior capsular opacification is gone, treated with the laser, it doesn't come back. So after cataract surgery, I typically advise everybody to just take it easy for about a week, and I think common sense goes a long way with this. If you want to go for a walk, I think that's fine. If you have a 200-pound dog, maybe don't pick him up for a week after the cataract surgery. Don't go swimming for 2 weeks after the surgery. If you want to do lawn work, I'm not so crazy about that because you're going to stir up all this dust, and then you're going to be rubbing your eyes when the dust gets in your eye. So I would just kind of take it easy. No headstands, no inversion tables. Just if you want to walk your dog around the neighborhood, that's fine. If you have a little 5-pound dog, you want to pick it up, no problem. But if it's a bigger dog or something else, then maybe let that one stay on the ground for a little bit. So the day of cataract surgery, you come in. You're going to go to a surgery center. You're going to fill out a bunch of paperwork, a bunch of forms, and then you're going to sit down. They're going to give you some eye drops. So your eyes can be dilated so I can do the surgery. And then you're going to get more eye drops, and then you get more eye drops, and then more eye drops the day of the surgery. And they're going to put an IV in so they can give you the medication that kind of makes you feel a little bit loopy, the Xanax type medication. The surgery itself takes around 5 to 10 minutes, and you're going to be lying flat. We're going to put a piece of tape over your forehead just to keep you holding nice and still, even though I know that you're going to cooperate perfectly. Some people don't. The surgery, there really isn't any pain. You're going to feel just some cold water, maybe a little bit of pressure. And then once the surgery's over, we're going to wheel you back into the recovery area. You'll sit there for about 10 minutes, maybe have some graham crackers, a cup of freshly brewed coffee, and then we'll let you go, and that's it. So when I set out to form this practice, my main goal was to give really optimal care for cataract surgery. I wanted to have the best equipment, which would give me the best results with cataract surgery, so that you have the least amount of prescription in your glasses, or a lot of the time you just don't have to wear glasses. So I bought everything brand new with the best that I could buy. So that's going to give you the best results. There's also the technical component. It's really difficult for me to speak of my own skill level. I've done thousands of cataracts. I typically do around 100 a month. I have a fairly low complication rate. It's probably around 1 in 500 to 1 in 1,000. But my business model is mostly just cataract surgery. I really enjoy doing cataract surgery. And when I opened up this practice, I sought out to provide the best care and to just do as many cataracts as I can, because I just find it so enjoyable. And I really like helping people and giving people great results. So Josie and I like to go on walks on the Swamp Rabbit Trail. She likes to walk me. We like to play fetch, although she generally doesn't bring the ball back, so it's really me chasing her around. So she likes to be chased. Her favorite hobby is begging for food. She's very good at that. She likes chicken. She likes steak. She's really not picky. She does like carrots, but that's really the only vegetable that she's interested in. I like to mountain bike. I got Josie so that I could go mountain biking. Josie doesn't really like to bike. She's good for about a mile, and then she's kind of done. Josie's favorite activity is just hanging out in the clinic and just saying hello. She's the Walmart greeter of Pisgah eye surgeons.